I don't think there's, anybody should be looking at this as a political answer. It's really all hands on deck. We have, I mentioned before, 0.36% of the population of the United States and over 3.5% of the deaths. This is a crisis that's happened in the last couple of years. The governor, to her credit, came up with leadership to bring the legislature back, getting the funding down into the towns and cities that need this revenues to go and get the treatment and the recovery that's needed. I think one of the things we can think about maybe a little bit differently is a lot of this opiates really change the brain chemistry, and I think we have to start thinking about getting medical treatment in terms of different ways to treat this is in peer-to-peer counseling, that kind of thing. But the most important thing I think a governor can do is to make sure we break down all of the silos of government and make sure the resources are going where they're most needed. And to me, that's treatment and recovery. Because what's happening is so many of these people take heroin and then we don't get the treatment and they come back and keep on doing and using and create crime. We need to put the resources where they're needed, and that's what a governor can do.
The opiate and heroin crisis is the biggest challenge facing New Hampshire today. It threatens not just lives, it threatens our economy. That's the scale we're at. So I've spent a lot of time prior to running for governor looking at this. I have about an $8 million a year plan that is focused largely on treatment at the local level. We need to get dollars to the local level where the best decisions get made, where specific treatment is needed. And it's really less about law enforcement, though we have the dollars there and should keep them. And we need to look at this less as a crime and more as a public health issue. And the resources need to reflect that as well. But it's how we prescribe medication, there is the case of interdiction, and then there is treatment. The plan, the $8 million plan, really addresses in a specific way all three elements which are necessary to combat the drug crisis.
We must overcome the drug crisis and addiction crisis that is threatening our state. We've started to come together to do that, but there's definitely more that we can do. I was proud to cast the deciding vote to extend Medicaid health care coverage to 50,000 of our fellow citizens. That includes a drug abuse, addiction, and treatment benefit that frankly we didn't have a few years ago. And thousands are already accessing care for addiction treatment services under it, but it will expire on our next governor's watch. I'm going to make that permanent. I'm going to do more to invest in preventative care, in treatment and recovery services. I believe that every kid in every school in New Hampshire should have both an education standard and a curriculum that helps them understand in an age-appropriate and evidence-based way the connection between prescription painkillers and heavier, more dangerous drugs like heroin and opioids and fentanyl. The fact is most people who are addicted to heroin in New Hampshire started on prescription painkillers. So education, prevention, cracking down on the drug companies that sometimes have been, I think, fraudulently marketing their pills in our state. Those are some of the things that we can do to be even more aggressive in overcoming this crisis.